So let's talk about chlamydia today. Chlamydia is one of the most common bacterial infections in the USA. It's a sexually transmitted infection that most of the time doesn't cause any symptoms. So we can miss it unless we get tested for it. If it does cause symptoms for guys, it's a clear discharge, which is liquid coming out of the penis. It can also go back along the tubes, and it can cause a prostatitis, which is an infection of the prostate. It can also go back further and then cause infection of the epididymis, which is where the sperm is matured, and that's called epididymitis. Now, for women, the consequences can be a bit greater. They can get symptoms, and their symptoms are a bit different. They can get burning with urination. They can also have discharge, but they can also have changes in their bleeding patterns, whether it's just spotting or sort of change in their menstrual cycle in general. Women also can have significant complications, the worst of which could be infertility. And so that's why it's really important to test for chlamydia and get it treated for both partners so that there are no consequences of the chlamydial infection. So testing basically is really easy. It's a urine test specific for chlamydia. You have to make sure that if you've talked to your doctor about being sexually active and talked about testing, it's more than likely going to be clear that he's doing the right test for chlamydia. But if you haven't had that conversation, then the urine test could be just testing for your kidneys and kidney function. The good part about chlamydia is that it's curable. It can be cured in two different ways. The most approved way is a 7-day treatment of pills twice a day. And then the next is you could take 4 pills at a certain dose all at once and you're good. You will be cured within a week. What's really important is to have your partner get tested and treated, particularly treated, and then you won't pass the infection back and forth. And how do you prevent it? Well, there are a couple of ways. One, knowing that your partner is negative for chlamydia and sort of having both partners tested is really important. Then using condoms. If you use condoms all the time, you won't get chlamydia. And the third way that's new is a medication that you can take within 72 hours called doxy-PEP, post-exposure prophylaxis, doxy-PEP. That can also prevent chlamydia, gonorrhea, and syphilis up to 60%. It's not 100%, so it's not the cure, and it's not the be-all, end-all, but it is something to help prevent.